I see.
Yes, you need to interact, because that is the level of modern medicine. You cannot afford to go to the hospital, whether by yourself or aiding a relative, and you leave everything to the doctor or the nurses to do, without whether consent issues. You don't know drugs being administered. You should ask questions. What are the side effects? So what it is with the consent, the main features of the consent form is that the patient needs to know the nature of treatment. The patient also needs to know the risk and benefits of that particular treatment. Now, the patient also needs to know alternative treatment procedures that exist to intervene in that particular condition. Now, in looking at that alternative treatment, we also need to know what are the risks and benefits associated with that alternative treatment. Now, the last rule in that particular legal protocol is that refer to the first point. And the first point is, has the patient understood the condition of treatment you are going to give? So after going through all these protocols, the fifth point refers you back to the first point. So if at the end of the day, you, the doctor or the medical officer in charge, you realize that the patient does not appreciate all of that, you need to take your time to take the person through, to give you the requisite consent. Because at the end of the day, anything that you do, either you are invading the person's body or you are committing negligence, depending on the circumstances that might prevail at that particular time. And I believe that nobody would necessarily want to put his head in that rope, because we are professionals, and as doctors or general health practitioners, these are protocols that they need to do at all times. Because I can imagine, and I know that most health practitioners don't apply for insurance.
And that's another issue
Yes,
as well.
so if you are not applying for insurance for your practice, for your medical practice, why would you voluntarily put yourself or expose yourself to these things? So we are taking this legal education to the doorsteps of the hospital. This time around, it is not about prosecuting them. It's about putting a friendly hand to them to say that you need to know A, B, C, D, so that you upgrade your skill and how you carry out certain things, so to lessen the degree of medical negligence, clinical errors, and physician liability cases in the country. Yeah.